Hello and welcome back. In this video, I'll be sharing with you how I did my 2-5 Emax crown cementation after removing the temporary crown that was made using a lock-on technique. This is the pre-op x-ray that shows the recurrent decay underneath the existing restoration for 2-5. I was actually going to record this cementation process using my microscope, but my assistant already set the appointment up in a different room, so I decided to take a bunch of photos so that I can walk you through them. This is the stone model with the crown placed on it for fit check. Sometimes I take iTero scans, other times I take PVS impression still. In this case, iTero scan would have been a great choice, but I simply went with what was already set up. This is what the temporary crown looked like at the beginning of the cementation appointment. The temporary crown was locked on without any temporary cement material underneath. A lock-on technique relies on adjacent contact areas for mechanical retention, which means patients are not able to floss in front or behind the tooth that was worked on. This is the burr that I use to create sections within the temporary crown. I don't know the official name of the burr, but I call this my crown removal burr. First, I make a buccolingual section, like so, and then a mesial distal one. You need to ensure that you're not going in the interproximal areas, nor touching the marginal edges of it, so that the crown prep is not altered during this process. Then, using an instrument that looks like this, which again, I don't know the official name, but I call it the paddle, I section the temporaries in 4 pieces, and I use a scaler to remove the 4 segments. If your sectioning depth and placement were proper, then you shouldn't have any issues removing the temporary pieces. It's similar to properly sectioning a wisdom tooth before removing the mesial root from the distal root. Clean break within the furcation area will allow cleaner surgery. And this is what the tooth looked like underneath the temporary. Patient has been wearing the temporary crown for the last 2 weeks. Now that the temporary crown is out of the way, I got my assistant to place a nice rubber dam, and the retainer I typically place 1 tooth behind the tooth that I'm working on. After cleansing the tooth, I proceeded to etching the tooth, drying and applying bond on the tooth, and isolating the tooth from adjacent teeth by placing Teflon tapes. While I was getting the tooth ready for cementation, my assistant cleaned the inside of the crown, which was contaminated with saliva after fit checking. After the crown was properly cleaned and tooth properly isolated, I got my assistant to load the crown with the cement, and the extra cement was cleaned before curing using a brush. I used a dual cure cement for this case, and once the cement was properly cured, I used a scaler to remove the excess in between, and also used a white quick strip to go in between the contact areas. There are different colors for these quick strips, and different colors mean different coarseness, but for a white quick strip, there is no coarse surfaces on the side, but rather only at the edge. So this ensures that when I'm using a white quick strip, I'm not opening up the contact area. And this is what the crown looks like once everything has been cleaned off. Using a rubber dam has made the cement removal process so much easier because everything's nicely isolated. I don't have to worry about patient's tongue or crevicular fluid creeping back up, damaging the gum tissues unnecessarily during the removal process. Even though it takes time to place the rubber dam on, it is definitely worth it. Once the patient was sat back up, I took a final x-ray to ensure that there is no extra cement left behind interproximal areas as well as below the gum tissues. Hope you enjoyed the video. I'll see you at the next. Bye!